Last week, Guardian figures revealed that black and minority ethnic people are up to 27% more likely to die from coronavirus. We speak to Dalia Gebrial, a PhD researcher at the London School of Economics, to find out why. Check it out.
Hi, my name's Dalia and I am a PhD researcher. I look at race and work, and I'm also a kind of freelance journalist who sometimes pops up on your timeline, causing a lot of probably anger. So we're seeing a significantly larger proportion of BAME, black minority ethnic people of colour, dying as a result of coronavirus. We've just had a headline in the Times today which says that twice as many black patients are dying in hospitals of coronavirus as white patients. So there has been a very concerted effort by the media and also by the whole narrative of the government to present this as a cultural, at best, a cultural or behavioural problem with people of colour, or at worst, a biological problem. So going back to sort of the good old eugenics, we've seen some arguments that black people have vitamin D deficiencies and therefore they have lower immunities, and that's, they should have been taking their supplements basically, all the way to black people of colour are simply just not obeying social distancing rules because they don't listen to instructions, etc., etc. The real reason is because, like all crises, this coronavirus crisis is a kind of culmination of economic, political, and social crises that have been happening for a very long time. So we're looking at what kind of work people of colour are doing. They're doing work that has very high risk of catching the virus. So things like delivery drivers, care workers, but we're also seeing the impacts of poverty. We're seeing the impacts of the fact that a much higher percentage of people of colour having to live in multi-generational, overcrowded housing. And there's also a lot of literature on actually how people of colour interact with the health service. For example, we know that healthcare professionals are less likely to take the symptoms of pain expressed by people of colour seriously. The summary is that race is not a biological category. It doesn't have biological consequences, but the social, political, and economic effects of race can have biological, physiological effects. There is certainly a disconnect between clapping for the NHS, of treating the NHS as this kind of, I've seen a lot of very kind of warlike language, supporting our troops, supporting our nurses, and the fact that consistently the government that we have had for the past 10 years has consistently underfunded this institution in a cynical attempt to privatise it. We have been led by a government whose ideology has very much centred around withdrawal of the welfare state in particular, leaving vast populations, particularly working class, particularly people of colour, very vulnerable. But now that we're in a crisis, the necessity of socialised healthcare, the necessity of a welfare state has become starker than ever. These kinds of crises are the ones in which the scripts of new worlds are written, basically. For me, the word that keeps coming up is this idea of universalism. Universalism needs to be at the core of our system, that everyone has universal basic rights to the means of life. And so now is the time to argue for a universalism that exists in times of peace and in times outside of crisis, so that we can sustain through those times of crisis without the scale of devastation and unpreparedness that we are seeing now.
So what do we know? We know that amid continuing concerns about the provision of PPE for those on the front lines, 40% of doctors, 20% of nurses and 67% of health and social care workers are all BAME people. We know that BAME people are more likely to be in poverty. We know that they make up over half of the overcrowded housing in this country, and that they have 11 times less access to green space than the rest of the population. We know that coronavirus is exposing and exacerbating the racial and social inequalities in our society. And, as Dalia says, we know that from within crises, the scripts of new worlds are written. So let's help right them. Thanks so much. Come back next week. Remember to like and subscribe.